Good morning. My name is Christine Zeller, and I'm a program manager in the MCW Office of Community Engagement. Thank you all for joining us today as we celebrate the exceptional individuals who are the recipients of this year's President's Community Engagement Awards. Please take note that this session is being recorded. Also, we have a special commemorative booklet of the ceremony in a PDF format. We will post this on our website along with the recording, and we'll send it out via email and other channels. To our audience, please stay mute and with your cameras off. Awardees, please turn your cameras on when you are being acknowledged. We encourage everyone to share comments by using the chat bar. At this time, I would like to extend sincere thanks to the members of our President's Award Committee who devoted much time and thoughtful consideration to carefully reviewing our many outstanding nominees and selecting the winners that we honor today. Our committee members this year are Melissa Denomi, Allison Devan, Sabina Deer, Lisa Dodson, Mark Flower, Tiffany Frazier, Brett Fuller, Kathy Kuhn, Michael Levis, John Moyer, Sharon New Young, Jessica Olson. Your contribution to these awards has been vital, and we are indebted to you for your dedicated work. Thank you. We also would like to thank MCW President and CEO, Dr. John R. Raymond Sr. and his wife Maggie, along with the Julia A. Eline Dean, School of Medicine Provost, and Executive Vice President, Dr. Joseph E. Kirschner, for their generous donations for an engraved plaque for each awardee this year. We also have a record of each awardee engraved on a large wall plaque of all historical winners that we proudly display in our office area. As part of this award ceremony, we in the Office of Community Engagement acknowledge the Indigenous people who are past and present stewards of the land on which we pursue our just cause of a healthy community for everyone. At this time, I would like to introduce MCW President and CEO, Dr. John R. Raymond Sr.
Thank you, Christine, and good morning, everyone. It's my pleasure to welcome our guests, partners, faculty, staff, and students to the Medical College of Wisconsin's virtual President's Community Engagement Award ceremony. I regret that I'm unable to attend today's virtual ceremony in person, but I do want to extend my thanks, my gratitude, and my congratulations to all who are being recognized today. MCW has a strong and proud history of supporting community engagement. In fact, it is one of our 4 stated missions. At its heart, community engagement at MCW encompasses elements of education, clinical care, research, prevention and control, and community outreach, community service, and community partnership. MCW is dedicated to leadership and excellence through our community engagement mission and by partnering with public and private organizations to enhance learning, research, and patient care for the health of communities in Wisconsin and beyond. Now, the President's Community Engagement Award recognizes the exemplary community academic partnership, community-based participatory research, community engaged research, or community outreach activities of our faculty, staff, students, and community partners of the Medical College of Wisconsin. Nominations are typically reviewed by members of our Community Engagement Award Committee, and the awards are based on institutional and community impact, the strength of our community partnerships, effort toward partnership and project, evidence of exceptional partnership and project outcomes, and overall merit. The recommendations of the committee were then shared with me. I have to say, I'm always so impressed by the achievements, accomplishments of all of our nominees, and I'm especially touched by their dedication to advancing community health in Milwaukee and beyond. And I'm humbled by the partnership and the bi-directional learnings that we're all able to enjoy because of the community engaged mission. So I want to thank all of today's awardees and congratulate you You exemplify excellence in community engagement and in the academic community partnerships. Now I'd like to turn the program back to Dr. Staci Young, who will introduce our awardees. Dr. Young has served as our Interim Senior Associate Dean for Community Engagement in the School of Medicine since March of this year. She's also an Associate Professor of Family and Community Medicine and Director of our Center for Healthy Communities and Research. Dr. Young, we're grateful for all of the important work that you do, both for MCW and for our community. We're very fortunate to have you here. Thank you so much for your leadership.
Thank you so much, Dr. Raymond. I am so proud and happy to be here to present the 7th Annual President's Community Engagement Awards to the outstanding individuals we honor here today. With each passing year, we build a larger and stronger group of people who are dedicated to achieving excellence in community engagement. To our awardees, your presence here today is a powerful testament to the impact of community engagement and the wealth of resources we have built for improving the health of the communities that we serve. Thank you for being here as exemplary representatives and dedicated stewards of our community engagement mission. I'd like to begin now with presenting our first award in the category of Community Partner. I am pleased to announce Asher D. Williams as one of the recipients. Ms. Williams has more than 25 years of experience working in the nonprofit sector of health and education. The focus of her work addresses health disparities and achievement gaps. In her current role as the Executive Director for the Milwaukee Area Health Education Center, AHEC, she partners with advocacy groups to increase engagement within local healthcare clinics. Ms. Williams also serves as a liaison to governmental agencies focused on diversity and health disparities. She directs an array of training programs, including AHEC Scholars, Aging Mastery Program, Community Health Internship Program, known as CHIP, the Youth Health Service Corps, and Interprofessional Case Competition. Since 2004, these training programs have been an invaluable resource for over 75 MCW medical and pharmacy students. In addition, MCW faculty have benefited from having 60 CHIP interns advance their research over the 8-week summer program. Ms. Williams was a key part of an AHW-funded project, Integrated Public Health, Nursing Training and Internship Program, which equips nursing students with improved understanding of public and community health issues. She's an active member of Mount Carmel Missionary Baptist Church's Praise and Worship Team and Choir, and is often seen with her 4 children volunteering for community service in the greater Milwaukee area. Congratulations, Dee Dee, for receiving this award.
I am overwhelmed with gratitude to have been selected to receive the MCW President's Community Engagement Award. Thank you all so very much to be able to share in this occasion with my peers, friends, and family. I'm so proud of the great relationships built over the years, addressing health disparities, supporting the training and education of our first generation and underrepresented students in higher education. And dear to my heart is in delivering the evidence-based programs to improve our health outcomes. We have accomplished so much together, and it means so much to me that the work I am so passionate about also resonates with others. This recognition is not something that I did alone, and there are many others who deserve to share in this award. So special thanks to Suzanne Letellier, our Director of Community Health Programs, Harvey Paddock, our Community Health Worker Coordinator, Melanie Berg, our Executive Administrator, Lauren Reeves and Haley Sanchez, our Project Specialists, and our Milwaukee AHEC Board led by the wonderful Tiffany Fraser for their steadfast support and active role in our mission. We have over 130 years of experience implementing 9 programs simultaneously within a year and reaching over 1,000 students and community members. I would also like to thank my family and friends for their love and support throughout this journey as the Executive Director of Milwaukee Area Health Education Center and my many other adventures. Last but not least, thank you to the Medical College of Wisconsin for offering recognition to community-driven leaders like me. I hope that this recognition serves as an inspiration to others that the community should always be part of the planning and decision-making process of any project developed, and that their values and needs and wants should be reflected in what's constructed and planned around them. Our work makes a difference. I will continue my efforts to increase the diverse distribution of healthcare professionals, throughout Southeastern Wisconsin through our strategic partnerships. And I look forward to celebrating with all of you here today in our 30th anniversary, June 2022, as a catalyst for change in Southeastern Wisconsin. I'm humbled and appreciative. Thank you.
Our second award for Community Partner goes to the team of community health workers, Otis Winstead Jr., Wade Fernandez, Cecilia Garcia, and Tu Fong Lee. This amazing team provided ongoing direct service throughout the COVID-19 pandemic to 4 communities of color in our area. Mr. Otis Winstead Jr. served as the lead for the African American community. Mrs. Cecilia Garcia served as the lead for the Hispanic community. Mr. Tu Fong Lee served as the lead for the Southeast Asian and Hmong communities. Mr. Wade Fernandez served as the lead for the Native American community. This team's work stemmed from the AHW-funded Stop COVID-19 project, which provided culturally tailored COVID-19 public health information to the communities. This effort, called the Creative Health Collective, focused on community-generated, equitable response strategies to COVID-19 and was facilitated by MCW, the City of Milwaukee, and the County of Milwaukee. Each of these individuals worked to enlist other community health workers to identify and address community needs. Together, they assisted the Milwaukee Health Department in adapting and translating public health information as needed, and then distributed this information to their respective communities. These community health workers became the eyes and ears of the city's response to COVID-19 in communities of color, offering critical insights about how and where to direct services during the early days of the pandemic. The impact of this frontline work included the delivery of hundreds of thousands of masks to communities of color in collaboration with Mask Up MKE. Tens of thousands of pounds of food relief and household essentials such as diapers were also distributed across the city of Milwaukee into Racine and Kenosha and to the Menominee Reservation. The team also provided referrals for rent, housing, and healthcare assistance. These community leaders were so effective that when the health department transitioned to vaccine distribution, they were asked to aid in developing culturally tailored, multilingual vaccine confidence communications. At this point, I'd like to say a few words about each of these extraordinary team members who individually are worthy of this award. Mr. Otis Winstead Jr. has been an important partner of MCW for over 10 years with collaborative work focused on veterans' health issues. He is the executive director of Dry Hooch of America, a veteran-led social service agency. Otis has worked on multiple research projects in collaboration with MCW to improve veteran reintegration into civilian life and recovery from trauma and substance abuse. Otis was instrumental in organizing the African American Veterans Memorial while at the Milwaukee War Memorial Building. This effort has been decades in the making, and Otis catalyzed the work and aspirations of many organizations, including the Milwaukee NAACP, the Wisconsin Black Historical Society, and the National Association for Black Veterans to make this memorial a reality. More recently, Otis assisted MCW in the earliest days of the pandemic by helping to manage logistics of mass distribution to the community. Thank you, Otis, for your continued partnership with MCW. Mr. Wade Fernandez, Wichi Win Upis Muhuao, walks with the Black Wolf, was born and raised in the ancient forests of the Menominee Indian Reservation in Wisconsin. Wade is committed to social justice, environmental justice, community health, and promoting the benefits of music and education. Wade has won multiple international awards, such as the Male Artist of the Year from the NAMMYs, Native American Music Awards, Community Spirit Award from First Peoples Fund, Storyteller of the Year from Wordcraft Warriors, the Medal of Honor from his tribal nation, and the Medal of Honor from his tribal nation. During the recent pandemic, Wade was instrumental in delivering COVID-19 messaging and care to underserved communities through the film, music, and live streaming, while also delivering basic needs on the ground with Creative Health Collective. Thank you, Wade, for all of your important work. Mrs. Cecilia Garcia is a community health worker who has worked for the Latino community in Milwaukee for more than 8 years. She is dedicated to providing resources and services to low-income families. Cecilia has served as a research ambassador in the Latino community for major MCW initiatives like the NIH-funded All of Us program. During the pandemic, Cecilia worked to collect and distribute food and other essential items for many families who had increased needs during these challenging times. She went door to door, reaching hundreds of businesses on the south side of Milwaukee with mask ordinance posters from the city, infection control information, and mask kits for business owners to give to their patrons. Cecilia's work with the team to help her community has helped her fulfill her passion for serving others. Thank you, Cecilia, for your dedication and your courage. Mr. Tu Fong Lee is a first-generation college student having graduated from UW-Milwaukee and is currently completing his master's in education. His passions are in public service and studying race and gender dynamics. Currently, Tu serves as a disease intervention specialist with the City of Milwaukee Health Department. He and his life partner, Si Tong Yang, are the founder and owners of Outcast Alterations, Wisconsin's first out and proud Hmong LGBTQIA+ owned business. Tu supports communities of color in assessing education equity and creating safe spaces for LGBTQIA+ youth and addressing domestic violence and sexual assault. During the pandemic, Tu used textile arts to create masks that were culturally meaningful for the Hmong community to help facilitate conversations about the importance of mask wearing and infection control. Tu attended events, for example, She Sang Marketplace, to distribute masks, hand sanitizer, and public health information to the Asian community. Thank you, Tu Fong, for your important work. Congratulations to all of you for the tremendous dedication and tireless service you have provided for your communities.
First, I'd like to, I'm really humbled by this whole thing, actually. I'd like to thank God. It's been a journey, but it's been a very humbling journey. And when I talk about humility, I'm talking about the opportunity that he's given me to work with such great people. What's on my mind is the approach that the medical college has given community engagement. And I'm gonna speak briefly about that because I have a lot of people to thank. But this new approach to, I'm gonna mention some people's names like Zeno and Jeff and Katinka, and Leslie. Those are doctors. And when I was coming up, you really had to say doctor, whoever that may be. But this approach to community engagement where they're bringing their lived experiences to the community, that's so vital, and they're doing such a great job of it. I mean, it's nice. Zeno's a doctor and I can talk to him. I can just call him Zeno. That's that whole community engagement approach that's really much appreciated. MHA, Martinez and Brian, I want to thank those folks too who have been along. They've also been on this journey with me, supporting and motivating me, as long as folks at the VA hospital, the folks at Marquette. I'd like to thank my team that I'm working with here with the COVID-19 that this past year, Wade, Cecilia too, and also Wade, Cecilia too, and myself actually. That's us four. But I want to thank those folks because diversity was important to me, and I was able to take a look at the different cultural difference. And the bottom line is that we're probably more alike than different. I found that out whenever I worked up in Menominee with Wade. I found it out when I worked with Tu, and I also found it out when I worked with Cecilia. So this has been a great partnership, and the support that I've gotten from them has also been great. I want to thank Bob Curry. Bob Curry, who his vision was for Dry Hooch. He is my mentor. He has been my mentor. He kind of carries me under his wings. So I'm really appreciative to him and what he's done with veterans and whatnot. And my wife, Myrtle, who's kind of like, been there the whole time, through my ups and downs and whatnot, And the peers that I work with, they gave me that title of executive director, but really I'm just a peer guy. I'm just a peer guy at heart, and so my whole staff and the people I work with from day to day, I want to thank them. This is not like the prior recipient said, it's not about me at all. I drive a truck, and I deliver food. This is about the people that are around, and the people that support. It's like a village piece, so I can appreciate being here. And thank you very much for this honor.
Poso na Tanaway Makanak Mishik Manuiak Machitok Eswasian Machiwan a piece Mahwa Wade Fernandez Mokumana na Eswasian Oasa na Totem. I just want to say it's a great honor to be here, great honor to be part of a wonderful team. I'm really honored to work with all of you and learn so much from all of you. And I'd like to, do something with the music a little bit, because I know there's going to be a lot of words here. And if you would like to put your minds and your thoughts together for that whole team that's here, that's being honored, but even beyond that, that team of people that we learn from, that are out on the streets, that and extend beyond that, the trees and the water and the land, we're learning from all this, and we're all part of this team. So I'm just going to play a little bit. And put your minds together for that. So I went and I'd like to pass the baton on to Cecilia.
Thank you so much. So thank you. So seriously, I did not, expect this recognized. It's great to not to be selected and this for me. So I have been 8 years how community health worker. So I'm sorry, I'm crying because I remember when I helped to the people and really, so when I think about it, how many people is in crisis, for me, my heart is touched my heart, So, but thank you so much for select to my team. So for me, Otis, Wade, and you are great persons, and you are my best team. So thank you so much, American College. Thank you.
All right, I want to start out by reading a quick quote. Giving does not only precede receiving, it is the reason for it. It is in giving that we receive. That quote is by Israel Ivor. And I guess in the past year alone, we've all just been trying to get by. And by being with this team, being with the medical college in the city of Milwaukee, and responding to the needs of the community, I was able to receive so much knowledge and holistic growth in return. And I've not heard the world come together. I haven't seen people come together in this way in a very long time. So thank you to the medical college, to the city, to Wade, Otis, Cecilia, Dr. Zeno, and also Michael, and so many more deserving community and frontline workers. You are all allowing me to hear the world in a way that we so needed to right now. So thank you.
So much to all of you, Otis, to Cecilia and Wade, for the beautiful words and music as well. The second category of awards is for MCW students. I am pleased to announce the team of Suma Samudrala and Justin Lairden as recipients. Suma is a Wisconsin native who graduated from the University of Wisconsin-Madison. She is currently completing her graduate school training as part of MCW's MD-PhD Medical Scientist Training Program. Justin was born and raised in Sun Prairie, Wisconsin, and graduated from UW-Madison. He is currently a medical student of MCW, set to graduate in May of 2022. Suma founded the program My Life, My Story at the Zablocki VA Medical Center, for which she currently serves as chair. Justin serves as the program vice chair, having collaborated with Suma to develop the program from the ground up. The program is based on the idea that a thorough understanding of a veteran's past will enable healthcare providers to improve their quality of care. Healthcare trainees interview veterans to learn about their past and then write a first-person narrative in the veteran's voice. This narrative is then added to the patient's medical record. The program benefits veterans by contributing to improved quality of care and also benefits healthcare trainees by allowing them to practice and hone their interpersonal skills such as communication, empathetic understanding, and rapport building, skills which are important for their success as future healthcare providers. Suma and Justin recruited volunteers from medical, graduate, and pharmacy schools to interview veterans, and they currently oversee over 40 student volunteers. They have also ensured that all healthcare team members, including physicians, nursing staff, and social workers, understand the purpose and importance of the program. With the COVID-19 pandemic, this initiative has become more essential than ever as face-to-face interactions between veterans and their healthcare teams shifted to a virtual format. Suma and Justin recognized the opportunity for the My Life, My Story program to promote necessary conversations between veterans and the healthcare team. Congratulations, Suma and Justin, for receiving this award.
Hello, Dr. Young. Thank you so much. Hello, everyone. Justin and I would like to thank the Office of Community Engagement for this recognition. We are humbled to receive this award and be among these amazing recipients. As some of you may know, we've been part of the My Life, My Story initiative at the Milwaukee VA Medical Center. This program, as Dr. Young has spoken about, seeks to promote human-centered and provider-patient interactions. At the core is the notion that a thorough understanding of a veteran's past will enable providers to better empathize with their patients. This program seeks to provide information to clinicians about these past experiences that is relevant to the veteran's care. Healthcare trainees who volunteer in this program interview veterans at the Milwaukee VA Medical Center, learn their story, and gather details that extend well beyond their medical history. Following this conversation, the trainees write a first-person narrative in the veteran's voice. These stories are then written in a narrative format and uploaded into the medical records so that all members of the healthcare team, doctors, physicians, nurses, can learn more about their personal lives and experiences to provide patient-centered care. Since establishing the program in 2019, we've connected dozens of local veterans with volunteers. We expect significant growth in the upcoming year as we conduct outreach among the MCW, Milwaukee VA Medical Center, and the local communities. Most recently, this initiative has gained media traction, and I shared this program with our local Milwaukee community on National Public Radio, NPR, and Spectrum One News.
Thanks, Suma. Thank you, everyone, too. And I'm very humbled to be part of this great community of people doing incredible work. Very humbled. Just to add a few more details, the My Life, My Story program is created really to benefit all the stakeholders involved. That includes the healthcare trainees, the veteran patients, and the clinical providers. In our preliminary feedback surveys, trainees have reported increased comfort in speaking with veterans, higher empathy following the interview, and stated that the interaction overall had a meaningful personal impact. On a similar note, veterans have reported high satisfaction with the program, increased comfort interacting with medical personnel, and overall found the process to be a worthwhile part of their healthcare journey. We've grown the reach of the program significantly. We've expanded our volunteer pool to include all MCW health professional trainees. That includes students from the medical school, the graduate school, and the pharmacy school. And we're always looking to improve our survey verbiage based on the feedback we receive from veterans and volunteers. In the future, we hope to expand these surveys to better understand the ways that providers utilize these life stories, both in the medical records and in their everyday patient care. We are immensely thankful to our advisors here in Milwaukee, Dr. Berger and Dr. McBride, along with Kim, and also our advisors over at the Madison VA, Seth and Thor. We are very grateful for our community partner, the Milwaukee VA Medical Center, who's given us the opportunity to expand this program. We are so thankful for our veterans who have so graciously shared their stories with us, and all the volunteers from the medical, graduate, and pharmacy schools who have taken these stories and written the narratives in the voice of the veteran. Finally, Suma and I would like to personally thank our family and friends who have supported us throughout the development of this initiative. Thank you all so much.
The third category of awards is for MCW staff. We have 2 individual winners within this category. Our first awardee is Shavon McCullum. Shavon is one of the senior administrative assistants in the Department of Orthopedic Surgery. Siobhan was raised in Milwaukee and has lived in many neighborhoods within the 53206 zip code and is a graduate of Riverside University High School. Inspired by her work in the foster care system, Siobhan founded the nonprofit Secure Bridges in 2019. Secure Bridges is dedicated to dismantling youth sex trafficking in Milwaukee by offering transitional housing and employment growth opportunities for youth aged 16 to 24. Siobhan speaks publicly at schools, churches, and other venues to continue to get the word out and raise awareness about youth sex trafficking. She has aligned herself with other organizations in the Milwaukee area, such as the Milky Way Tech Hub Accelerator, to promote her cause. Secure Bridges is currently partnering with West Care Milwaukee for Harambe neighborhood initiatives, such as the Weekly Eats Food Pantry, the Prescription Drug Take-Back Program, and the Community Ride Bicycle Tour. Currently, Siobhan serves as co-chair on a subcommittee of the Milwaukee Healthcare Collaborative Against Sex Trafficking, providing resources for continuation of care for sex trafficked and exploited individuals. Siobhan also serves as chair and co-chair for subcommittee within the West Care Wisconsin Pulling Together for a Drug-Free Community Coalition. Congratulations, Siobhan, for receiving this award.
Hi, everybody. Again, my name is Siobhan McCullum. And I would like to first say thank you to the Medical College of Wisconsin. Thank you to my department. I work in orthopedic surgery, and I am super blessed and privileged that they support the work that I do. They've hosted many fundraisers and drives for Secure Bridges to have the opportunity to go out and feed our youth, feed our families, and provide them with not only education, but opportunities for advancement. Secure Bridges is not only a community organization, we are also a tech company, and has pitched our tech idea in many pitch competitions. That in the most recent one, we were sixth of an awardee for the opportunity to take our tech idea into beta. So we just look forward to the continued success of our youth who will eventually lead us in the next few years. So thank everybody so much. Thank you to the community engagement for this opportunity. Just stay tuned to Secure Bridges on all platforms from LinkedIn to Instagram, just to stay involved with the work that we're doing and opportunities for collaboration in the future. Thank you.
Great, thank you. Congrats again, Siobhan. Our second award for MCW staff is presented to Christina Hoppy. Christina is the education coordinator for the Community Pediatrics Training Initiative Rotation and the Pediatric Residency Global and Community Health Track and the Pediatric Residency Advocacy Committee. Since joining the team in 2018, she has helped strengthen existing community partnerships and expand outreach in the community with additional partnerships. Christina coordinates monthly interactive educational sessions with approximately 20 community partners each year. She seeks to truly understand the needs of all community members, bridging the gaps that exist between families and providers. She takes the initiative in seeking and finding potential new community partners for the rotation. She also promotes volunteer opportunities for our medical trainees through her community involvement. Her close work with the partners has built relationships between MCW and the broader community as she fosters bi-directional learning and creates welcoming and inclusive environments. Christina became a recent member of the Children's Health Literacy Task Force and Best Babies Zone West Lawn. She sees these as opportunities not only to grow and learn, but also to continue to share resources and knowledge with others. Congratulations, Christina, for receiving this award.
Thank you, and thank you to Dr. Raymond, Dr. Young, and the entire community engagement team at MCW for all your work and efforts in prioritizing and really supporting our engagement and outreach in the community. And congratulations to all the awardees being recognized today for your achievements. I would like to thank my nominators, Dr. Gundacker and Dr. Nelson and Becky Kanitz from Pathfinders, really for all their support and acknowledgement as well. I am very certain that we can all agree 2020 was a very difficult and challenging year for everyone. Instead of being a time to slow down or stop our work in the community, We reached out to our community partners and leaned on the relationships that we had built to really find innovative ways to continue our pediatric training program without hesitation. And while dealing with challenges and changes within their own organizations, all of our community partners really stepped up and committed to continuing to volunteer their time to meet with our learners. I am truly grateful for our community partners and parent participants for their flexibility, their dedication, and their commitment to our community training program. I can really only accept this award on their behalf. Community engagement is really a team effort, and I am fortunate to be part of an incredible team at MCW. I am humbled by the opportunity to work with and learn from so many talented faculty leaders, including Dr. Ernestine Willis, Dr. John Moyer, Dr. Lisa Zetley, Dr. Heather Parody, Dr. David Nelson, Dr. Michael Levis, Dr. Connie Gundacker, Dr. Mike Gerber, Dr. Karen Markdante, Dr. Margolis, and many, many more faculty who have been my role models for community engagement and continued learning. To my super supportive family and my team in pediatric medical education, our medical students, residents, fellows, and parent participants, thank you for inspiring and motivating me to always do my very best. Together, we are all working to strengthen our team, our community, and each other. I look forward to continuing to learn, grow, and strengthen our relationships in the community. Thank you for your time and recognition.
The fourth category of awards is for MCW faculty. This year we have 4 recipients. Our first awardee is Dr. Alonzo Walker. Dr. Walker is currently Professor Emeritus of Surgery. Dr. Walker spearheaded MCW's first formal diversity and inclusion efforts, including the Spring Festival of Cultures and the President's Diversity and Inclusion Awards. MCW's Cancer Center is indebted to Dr. Walker for his driving vision and guidance in developing the community outreach and engagement program. Along with Dr. Saeed Ahmed, Dr. Walker co-led the Cancer Center Task Force on Community Engagement in 2013, which developed recommendations for adopting principles of community engagement, which are still followed today. Dr. Walker was a leader in launching the Cancer Center Community Advisory Board, where he has been a member since 2014. His connections within the community were critical in lending legitimacy to the advisory board and in engaging key community partners to ensure its success. In 2016, he co-led the Diagnosis, Treatment, and Survivorship Work Group, which developed the Community Conversation series, featuring community-chosen topics such as Henrietta Lacks in cancer research, the Tuskegee experiments, barriers to participation in clinical trials, and LGBTQ Break the Disparity. These events touched over 1,000 lives in Milwaukee and beyond. Dr. Walker has been instrumental in the development of the Community and Cancer Science Network, which brings together those in academic medicine and in the community to work equitably to reduce Wisconsin's cancer disparities. Dr. Walker has been an important participant in the development and implementation of the AHW-funded cross-cutting efforts targeting cancer disparities in Wisconsin. He is a member of the Wisconsin Cancer Collaborative Steering Committee and a leader within the State Cancer Program and statewide coalition. Importantly, members of the Milwaukee community see Dr. Walker as a valued and trusted partner. Dr. Walker embodies what is best in community engagement, building mutually beneficial partnerships, creating an open and equitable dialogue between researchers and community, interrogating power structure to ensure an equitable distribution between community and research, and developing capacity for partnerships in both the MCW research community and in the broader Milwaukee community. Congratulations, Dr. Walker, for receiving this award.
Thank you, Dr. Young. Also, I want to thank the Medical College of Wisconsin leadership for this recognition, which focuses on the work of the Community Advisory Board of the Cancer Center of the Medical College of Wisconsin. In this, I will continue to work with the leadership of the Cancer Center's Office of Community Engagement in his work in the community. So regarding cancer in the community, there remains a lot to be done in terms of this educational effort. And there are many that are involved, like Dr. Staci, as well as Deborah Neville, and Jermaine Murray, and just to name a few of those individuals. So I hope to continue to work with the Office of Community Engagement in the Cancer Center as we continue the educational efforts, particularly throughout southeastern Wisconsin. So once again, thank you, Dr. Young, and the Medical College leadership, as well as the leadership of the Cancer Center for this recognition. Again, thank you very much.
Thank you very much, Dr. Walker. Congratulations again. Our second faculty award is for the team of Dr. Karina Norbaum and Dr. Amy Pernuski. Dr. Norbaum is a Central Wisconsin native who is an assistant professor at the Medical College of Wisconsin, Central Wisconsin. Dr. Norbaum co-directs the Physician in the Community Pathway and is a health policy fellow with the Wisconsin Institute for Public Policy and Service. Dr. Norbaum is passionate about addressing social determinants of health and engaging medical students in community collaborative efforts. She works to directly connect students with community agencies and mentors those who are working towards health improvement in Central Wisconsin. She co-chaired the Health Equity Track for the inaugural Toward One Wisconsin Statewide Inclusivity Conference. She brought Lena Start to Marathon County, a parent education program which focuses on increasing parent-child talk before age 3. She currently serves on the DC Everest School Board and Marathon County Board of Health. Dr. Norbaum organized the Hmong and Hispanic Communication Network at the onset of the COVID-19 pandemic to address disparities faced by immigrant communities. Her team partner, Dr. Amy Pernuski, is an associate professor and founding faculty member at the Medical College of Wisconsin, Central Wisconsin. She began her work in community-based science through the development of a Lyme disease outreach program, delivering interactive presentations to over 300 middle and high school students. She completed the MCW Community Engaged Scholars Mentoring Program, and she serves as a Wisconsin Institute for Public Policy and Service Fellow, working on issues related to equity and inclusion, early childhood education, and mental health. With Dr. Corey Norbaum, she has advised over 100 medical students in community-engaged research projects as part of the Physician in the Community Pathway. This collaboration has led to numerous partnerships and projects that have garnered grant funding and continue to impact the greater Wausau area, including Providers and Teens Communicating for Health program, the DC Everest Mental Health Wellness Day, the Advocates in Medicine Pipeline Program. Together, these outstanding MCW faculty members demonstrate the strength of teamwork by engaging and mentoring each other, MCW students, and community members to improve the health of Central Wisconsin residents in measurable ways. Congratulations, Dr. Norbaum and Dr. Pernuski, for receiving this award.
Thank you, Staci and the community engagement team. So first of all, I'd like to acknowledge that none of this can happen without amazing community partners and people working on teams and people also that are in the background. And I'd like to thank my parents and family for really laying the foundation for my passion for community engagement. My parents just really instilled and emphasized the value of every person and the collective as far as like the value of community. I'd like to thank the Wisconsin Institute for Public Policy and Service, which really has been an incubator for a lot of my community-centered project ideas. Thank you, Lisa Dodson, for nominating us and also just for your inspiration to have the most community engaged medical students in the country. Amy and I really take that seriously and hope that we can really accomplish that. And I'd like to thank the whole Physician in the Community Pathways team, especially Amy. I come from the world of clinical medicine and community engagement, and she comes from the research and teaching world, and I've learned so much from her, and I love working with her. And thanks to the amazing team with Kelly Mulder, and also now Terry Walkush, who have been coordinators and make things possible in terms of all of the many student projects and crazy ideas that Amy and I have in terms of bringing community to our medical school.
Great. Well, I just want to say I felt so supported doing this work and have interacted with so many amazing people. again, I do want to acknowledge President Raymond and Dean Dodson for, creating this vision for all of us. And again, they're two individuals that definitely walk the talk, and just having opportunities like this to celebrate all this amazing work is so important, and in some ways unique, that you don't find that at every institution. I've also had a ton of amazing mentors. As Corey said, I had come from a research and teaching background, but I was actually trained as a molecular biologist. And so I had a lot to learn, and Syed Ahmed got me involved in the community engaged mentoring group. And I just, have felt so welcomed here at MCW and had so many amazing colleagues. And again, it's too bad we can't connect in person, but, again, by Zoom, knowing, that so many of you are here today, we just really appreciate everybody's support, including, I see you, Staci, and Linda Moyer, and Kajwa, and Leslie Ruffalo, and I mean, everybody we ever reached out to, helped us kind of figure this out as pioneers up here in Wausau. Of course, I want to do a huge shout out to Corey again. It's one thing where, like, as an individual, you might be able to do one or two projects, but you get two people together with a lot of crazy ideas, it just sort of explodes. And, we've been able to do so much together, and just really appreciate, your friendship and just this opportunity to celebrate everything we've achieved. And at home, I've got Jake doing that for me too. And, my parents, that a number of people on this call know, are obviously some of my biggest supporters. And I think all of us do this work too, because we're trying to make the world a little bit better for the next generation. And so, I mean, Corey and I have delivered food with Lola and Owen, our kids, and things like that. And, again, they've been important drivers for this work. And Corey did a shout out for a number of our MCW faculty, but really, I just want to acknowledge our whole MCW CW campus. It's been about 5 years, it'll be in July, since we welcomed our first class, and we've all really been pioneers creating this work. And I've learned so much from our students and from our community partners, especially me, in terms of how do you network and build those trusting relationships and empower others. So I just wanted to end with this Thoreau thought, which is, you get by achieving your goals. What you get by achieving your goals is not as important as what you become by achieving your goals. So thank you.
Thank you. Congrats again, Dr. Norbaum. Congrats, Dr. Prunuski. Our final faculty recipient is Dr. Kajwa Lor. Dr. Lor is an associate professor with the MCW School of Pharmacy and is the founding chair of the Clinical Sciences Department. Dr. Lor earned her doctorate of pharmacy from the University of Wisconsin-Madison and is a board-certified ambulatory care pharmacist. Dr. Lor was the first Hmong pharmacist in the nation to obtain an academic pharmacy position. Since Dr. Lor began at MCW, she has served as a pillar for the MCW community with learners, faculty, and staff who identify as Asian American Pacific Islander. She works closely with the MCW's Asian Pacific American Medical Student Association to train medical students on cultural humility skills. Dr. Lor has built a strong network with Asian American Pacific Islander organizations across the state, including the Hmong Institute, the Hmong Milwaukee Consortium for Hmong Health, the United Hmong of Wisconsin Outreach, Hmong Wisconsin Chamber of Commerce, and the Wisconsin United Coalition of Asian Americans. Annually, Dr. Lor serves as a distinguished speaker at the Hmong Health Summit and has trained over 200 professionals on cultural humility skills with the Hmong. Dr. Lor was recently a fellow of the Robert Wood Johnson Foundation Clinical Scholars Program in a community engagement project in collaboration with Dry Hooch called Milwaukee Prompt, Prevention of Opioid Misuse through Peer Training. Dr. Lor mentors and contributes to the project Invisible Identities to highlight the importance of intersectionality and health disparities faced by Hmong LGBTQ+ patients. Since the pandemic began, Dr. Lor has not only advocated for the safety of Asian American and Pacific Islanders in the community, but also created various videos on COVID-19 to assist Hmong patients. She has also volunteered weekly to assist with the MCW COVID-19 vaccine clinic. In April 2001, her work in the community was highlighted when she was recognized with the 40 Under 40 Award by the Milwaukee Business Journal. Congratulations, Dr. Lohr, for receiving this award.
Thank you, Dr. Young, the Office of Community Engagement and the MCW leadership, including President Raymond and Dean McKinnon. So hello, everyone, and welcome. Today's a good day. I am so blessed. I'm really honored to just be among these amazing recipients and among my colleagues and my community engagement family. Very few things in life are entirely the work of just one person. This is no exception. And I want to pay tribute to the enormous contributions and support by those at home, behind the scenes, my husband, John, 2 children, Luke and Ella, my parents, my grandma, family and friends, to my mentors, learners, and students. Special shout out to those who nominated me to make this possible. Bill Wong from the Invisible Identities Project, Maizhong Vu from the Hmong Institute, and Mainza Tao, Executive Director of WIDA. And all community partners that I've worked with over the years. I just wanna thank and give my sincerest gratitude, because this would not be possible without all of you. When I started at MCW 5 years ago, I embarked on this community engagement journey, and I had the privilege to work with Dr. Saeed Ahmed with a project called Milwaukee Prompt, working with Dry Hooch and Mental Health America. And I learned about the importance of self-care and the road to recovery for addiction for veterans. I learned about establishing trust and the importance of honoring community voices in our work. And this project really inspired me to remember my roots, incorporating community engagement in the work that I do, building awareness and cultural humility with an invisible minority in Wisconsin, the Hmong community. And community engagement means showing up when no one else is around, understanding that people need to be really seen, heard, and loved, and the community needs to be included in the creative solutions to achieve health equity. I'd like to end with a blessing. So taka pe nyo to li je te li chua taka pe shi chu yi la ba pe hai ning ka chi chamo ma mang king ka pe nyo ka mu tai chi na wa chao. Thank you.
Thank you. Congratulations again, Dr. Lohr. At this time, I would like to introduce Greg Wesley, who will present our final award. Greg is a Senior Vice President of Strategic Alliances and Business Development at MCW. We are honored to have him here today. Greg?
Thank you very, very much, Dr. Young. The past 15 months have been exceptional in many ways. And because of the pandemic, our people have risen to overcome extreme challenges to help our MCW community and the larger community here in Milwaukee. It is because of this that we honor a special team of MCW faculty and staff who led the MCW COVID-19 vaccine program. Dr. Kristen Bussey, Professor Karen McKenna, Ms. Lisa Hank, and Ms. Pam Young. These highly dedicated individuals served as leaders of MCW's first clinic for dispensing vaccination against the COVID-19 virus. All 4 individuals were integral in planning and executing the vaccine program and overseeing the more than 500 individuals involved in the clinic operations. Dr. Bussey, a faculty member in the MCW School of Pharmacy, leveraged her skills from a decade of managing investigational drug trials to serve as a leader for logistics and inventory, compounding, clinical and regulatory issues, relations in and with the Wisconsin Department of Health Services and the National Guard, and also advising partner organizations. Ms. Hank, Chief Administrator in the Office of Research, established the administrative infrastructure and procedures needed to initiate an entirely new clinical unit within a few weeks of conception. Professor McKenna, also a School of Pharmacy faculty member, drew upon her extensive experience in retail pharmacy to train, supervise, and support vaccinators and non-clinical volunteers involved in operating the clinic. Ms. Young used her event management and communication skills to create and distribute tens of thousands of invitations and instructions, answer questions, and generally create a warm and inclusive environment that welcomed a diverse group of often nervous clients. The outcome and impact of this novel clinic is immense. 20,000 vaccinations were provided, with over 60% going to community members. The team intentionally supported MCW community partners, and in doing so, reduced disparities in vaccine uptake. Some of the community members receiving vaccinations included small practice unaffiliated healthcare providers, about 300 central city partners of the Thrive On collaboration, leaders from the city and county of Milwaukee and the NAACP, the Milwaukee Urban League, the Boys and Girls Club of Milwaukee, the YMCA of Milwaukee, clergy from several prominent African-American church congregations, faculty and staff of local education institutions, such as Next Door Milwaukee, which serves a predominantly vulnerable and minority population. The team partnered with the Milwaukee Health Department, offering valuable operational advice, which included on-site consultation and providing crucial compounding services for thousands of doses. The team also provided consultation to Milwaukee County Office of Emergency Management for vaccination services in rural areas. Another critical partnership that was developed was with the state of Wisconsin and the National Guard Delta 8 personnel for the Southeast Wisconsin Healthcare Emergency Readiness Coalition Vaccine Hub. The MCW team advised this group to help resolve logistical issues and inventory management. In this way, the MCW team indirectly vaccinated or helped vaccinations for hundreds of thousands of southeastern Wisconsin residents. In summary, Dr. Bussey, Professor McKenna, Ms. Hank, Ms. Young formed the nucleus of a team that has literally saved lives by administering 20,000 COVID-19 vaccinations to 10,000 persons. The success of this Herculean effort is a tribute to the dedication, the compassion, the skill, and the selflessness in providing this unique and monumental life-saving service.
Thank you for that lovely rendition of our work, Mr. Wesley. We'd like to thank so many people that made this happen. And, of course, President Raymond and his support of this effort, it wouldn't have been possible without. And also thank you for the community engagement team that is highlighting this effort as well. Of course, I'd like to thank everybody else on our leadership team who had a part in making the COVID-19 clinic run as smoothly and efficiently as it did. And these individuals include Jane Youngman and Ashley Sanchez, Karen McKinnon, Sue Maurerman, Jen Brown, Teresa Dabrowski, Pam Young, Jenny Bultman, and Lisa Hank. And of course, we had that leadership support of Dr. Ann Nanninger, who led the overall vaccine program, as well as Dr. George McKinnon, who facilitated and led the School of Pharmacy involvement as well. We had a large core team who should be recognized in addition to the small group that's here today, who was presented this award. And really our colleagues should know that we're receiving this award on their behalf as well, since we would not have been able to be successful without their hard work and contributions. Not to forget the countless other volunteers who dedicated their time and effort volunteering to administer vaccinations, monitor vaccine recipients, clean vaccination stations, and check people in. Without all of the 500 plus people who volunteered in clinic, the clinic would not have been possible. Everyone I worked with during the clinic experience, they expressed how much it meant to them personally to contribute to this historic vaccination campaign. To have such an impact on our institution and surrounding community was an honor. And I'm grateful to have had the opportunity to contribute in the way that I did. I believe our clinic was one of the first steps in ending the pandemic and ushering in the return of the new normal. And the hope and enthusiasm in the air during clinic was palpable. And because of all of the effort, both behind the scenes and in clinic, the ultimate result was one of the most rewarding experiences of my career. So thank you again to everyone who had a part in making the MCW COVID-19 clinic a successful vaccination campaign.
Hi, my name is Karen McKinnon, and it is an honor to be recognized for this award. And just as Dr. Bussey had mentioned, we are just part of the team that really took this vaccination clinic to its level of success. Although only 4 of us are honored today, there are so many others. And I would personally like to thank our School of Pharmacy leadership, especially Dean McKinnon, for having the confidence and foresight to know that we would excel in the facilitation of this COVID clinic. To our faculty and staff, especially Dr. Michael DeBishop, Jane Youngman, and Teresa Dombrowski, thank you for your commitment and willingness to modify your work and your personal schedule to assist in lab. To Dr. Nader, thank you for your support and your guidance and your kindness. This interprofessional clinic demonstrated the common mission and passion that MCW employees possess. Thanks to the many people, the nurses, the physicians, the PAs, the veterinarians, the research department, and the MCW learners who dedicated their time. You are the rainbow to this COVID cloud. I would also like to especially thank my husband, my parents, and my children for always supporting my professional career, even though the work-life balance was not always optimal. I love you and I thank you to the bottom of my heart. Not a day goes by that I did not feel like I had a purpose in the COVID pandemic solution. Patients needed us not to just immunize them, but to comfort and to care and to support them during this troubling times. Many patients never had even left their homes during this pandemic until they came in to get their vaccine. They appreciated the opportunity to talk to somebody face to face, and yes, they welcomed the 15 to 30 minutes required in the monitoring post-immunization area. So we hope to continue our newly formed professional friendships that we gained through this COVID clinic, as we appreciate each other's talents and friendship. So yes, we are the COVID kings and queens. So keep calm, vaccinate on. And as even Mr. Fernandez said, you know, music always is appreciated. So we, as our COVID kings and queens, let's ring that cowbell. And thanks.
Hi, everyone. I'm Lisa Hank, and so very pleased to have had a role in the vaccine clinic. Many of the kudos that have already gone out to our team members have been mentioned, and I'd like to call them out again. They are Jen Brown, Ashley Sanchez, Sue Maurerman. We have Brad Condon in there. We have, let's see, Corey Corral, and many others. I don't know what I would say other than many of us had zero clinical experience coming into this. So grateful to have delivered what we heard was a very good clinic from our constituents that did visit both in the community and within our walls here. So one thing I did want to share outside of my gratitude for being acknowledged for the effort is to thank Dr. Nadinger and also share one person's experience. As she was getting her vaccine, she said, "I'm getting my life back." And I was just amazed by that. So I take comfort in the fact that me, my team, the people I get to work with every day, were part of that effort and to deliver 20,000 doses and keep people healthy. So thank you to my friends on the call here, to Kristen and Karen, and to Pam, who's not on the call. And look forward to, again, more professional friendships and continuing our good teamwork together.
So I want to just say thank you for joining us at today's ceremony. Congratulations to all of the award recipients. I want to wish you all a safe and happy and prosperous weekend. Thank you for being here. Enjoy your weekend. I'm grateful that you chose to spend some time with us this afternoon. Take care, everyone.